How to masturbate safely after 60. Avoid these 3 big mistakes. Have you ever wondered whether masturbation is still healthy after the age of 60? Have you questioned whether your changing body requires a different approach than it did decades ago? If so, you're certainly not alone. It's a topic that many people think about but few feel comfortable discussing. Yet, the truth is that sexual wellness remains an important part of overall health throughout life. As we grow older, our bodies change in many ways. Our skin becomes more delicate, our joints may become stiffer, hormone levels shift, and certain medical conditions or medications can affect sexual function. None of these changes mean that intimacy with yourself has to end. In fact, for many older adults, masturbation continues to be a safe, enjoyable, and beneficial way to maintain sexual health, reduce stress, improve mood, and stay connected with their bodies. The key is understanding that what worked at age 30 may not be the safest or most comfortable approach at age 60, 70, or beyond. Small adjustments can make a significant difference in comfort, safety, and enjoyment. Today, we'll discuss 3 common mistakes many older adults make and, more importantly, how to avoid them. Our goal isn't just to prevent discomfort, it's to help you enjoy a healthier, safer, and more satisfying experience while respecting your body's natural changes. Sexual health is an important part of healthy aging, and there is absolutely no shame in learning how to care for yourself better. Let's begin with the first mistake. The first big mistake is using too much force or friction. As we age, our skin naturally becomes thinner and less elastic. Blood circulation may decrease slightly, and hormone changes can reduce natural lubrication in both men and women. Because of these changes, applying the same pressure or speed that once felt comfortable may now lead to soreness, irritation, or even small skin injuries. Many people mistakenly believe discomfort is simply a normal part of aging. It isn't. Pain is usually a signal that your body needs a gentler approach. Taking your time is one of the simplest ways to improve comfort. Slow, gentle stimulation often feels better and reduces the risk of skin irritation. Many older adults also find that using a high-quality water-based lubricant greatly improves comfort by reducing friction. If you notice persistent pain, bleeding, or skin changes, it's important to speak with a healthcare professional rather than ignoring the symptoms. Now, let's look at the second mistake. The second mistake is ignoring underlying medical conditions or medications. After age 60, many people take medications for blood pressure, diabetes, heart disease, depression, or prostate problems. Some medications can affect sexual desire, erectile function, vaginal dryness, or sensitivity. Conditions such as arthritis, Parkinson's disease, diabetes, or chronic pain can also change what feels comfortable during sexual activity. Instead of assuming these changes are something you simply have to accept, recognize that many solutions are available. Adjusting positions, using supportive pillows, taking more time for arousal, or discussing medication side effects with your healthcare provider can often improve comfort and satisfaction. For men, erectile changes become more common with age. This does not necessarily mean something is seriously wrong, but sudden or significant changes deserve medical evaluation. For women, vaginal dryness can become more noticeable after menopause, making lubrication especially important. The important message is this: never ignore persistent pain, unusual swelling, bleeding, or other concerning symptoms. Sexual activity should not consistently hurt, and your healthcare provider can help identify safe treatment options if needed. Now let's move to the third and final mistake. The third mistake is neglecting hygiene and overall health. Good hygiene is an essential part of safe sexual activity at every age. Washing your hands before and after masturbation helps reduce the spread of bacteria. If you use sex toys, clean them carefully according to the manufacturer's instructions after every use. Never share toys without proper cleaning or protection. Hydration also plays a role in sexual comfort. Drinking enough water supports healthy skin and tissues throughout the body. Regular exercise, balanced nutrition, quality sleep, and stress management all contribute to better sexual health by improving circulation, energy, flexibility, and overall well-being. It's also important to create a comfortable environment where you can relax without rushing. Stress and anxiety can reduce enjoyment and increase muscle tension. Taking your time, breathing deeply, and listening to your body's signals often lead to a much more positive experience. Finally, remember that there is no normal frequency for masturbation. Some people choose to masturbate regularly while others rarely do. Both can be perfectly healthy. What matters most is that it feels comfortable, does not interfere with your daily life, and supports your overall well-being. As we conclude, remember this important message. Getting older does not mean giving up your sexuality. Your body may change, but with patience, gentleness, proper lubrication, attention to your health, and good hygiene, masturbation can remain a safe and healthy part of life well into your later years. There's no reason to feel embarrassed about caring for your sexual health. Just as we care for our heart, muscles, and mind, we should also care for this important aspect of overall wellness. Listen to your body, respect its changes, and never hesitate to seek medical advice if something doesn't feel right. Thank you for spending this time with me today. If you found this information helpful, consider sharing it with someone who may benefit from it. Open conversations about healthy aging help reduce stigma and empower more people to live healthier, happier lives at every age. Growing older often brings changes that many people expect, such as graying hair, aching joints, or needing reading glasses. However, one topic that is rarely discussed openly is sexual health after the age of 60. Many people mistakenly believe that reaching this stage of life means intimacy, sexual pleasure, or even self-exploration should no longer be part of their lives. This belief is not supported by medical evidence. In reality, sexual health remains an important aspect of overall well-being regardless of age. While the body changes over time, the need for physical comfort, emotional connection, and personal satisfaction does not simply disappear. Understanding these changes and adapting to them can help older adults continue enjoying a healthy and fulfilling intimate life while supporting both physical and emotional wellness. Masturbation is a normal and healthy sexual activity for many adults throughout life. It is a personal choice, and there is no age at which someone is expected to stop. For many people over 60, it provides a safe way to experience sexual pleasure without concerns about pregnancy or sexually transmitted infections from a partner. It also allows individuals to stay connected with their bodies and better understand how aging has changed their physical responses. Becoming familiar with these changes can improve confidence and reduce unnecessary worry about what is considered normal. Many healthcare professionals recognize masturbation as a healthy part of sexuality when it is comfortable, consensual, and does not interfere with everyday responsibilities or relationships. One of the greatest benefits of maintaining healthy sexual expression later in life is its positive effect on mental health. Sexual activity, including masturbation, stimulates the release of chemicals in the brain such as endorphins and dopamine. These natural chemicals are associated with pleasure, relaxation, and improved mood. Many older adults experience stress related to retirement, caregiving responsibilities, financial concerns, or health conditions. Moments of physical pleasure can offer temporary relief from daily stress and contribute to emotional balance. Some people also find that masturbation helps reduce feelings of loneliness by providing a comforting sense of self-care and body awareness. While it is not a substitute for meaningful relationships or professional mental health support, it can be one healthy component of overall emotional well-being. Sleep is another area where sexual health may offer surprising benefits. Many older adults struggle with insomnia or interrupted sleep. Following orgasm, the body releases hormones that promote relaxation, and muscle tension decreases. This natural calming response may help some individuals fall asleep more easily or enjoy a more restful night. Although masturbation is not a treatment for chronic sleep disorders, some people find it becomes part of a relaxing bedtime routine that supports better rest. Quality sleep is closely linked to improved immune function, clearer thinking, better mood, and healthier aging overall. Physical health also plays an important role in sexual wellness. Sexual arousal increases blood flow to the genital area, which helps maintain healthy tissues. For men, healthy circulation supports erectile function, although erections naturally change with age. For women, regular sexual stimulation may help maintain vaginal tissue elasticity and comfort, particularly after menopause when estrogen levels decline. These benefits do not prevent every age-related change, but they may contribute to maintaining comfort and function over time. Gentle sexual activity can also encourage awareness of the body's normal appearance and sensations, making it easier to notice unusual changes that may require medical attention. Another reason sexual health matters after 60 is that it reinforces the idea that aging does not erase a person's identity. Society often sends the message that sexuality belongs only to younger people, leaving many older adults feeling embarrassed or invisible. These stereotypes can discourage open conversations with partners and healthcare providers. In reality, people continue to value affection, intimacy, pleasure, and connection throughout their lives. Accepting sexuality as a normal part of healthy aging helps reduce shame and encourages individuals to seek reliable information rather than relying on myths or misinformation. Doctors, nurses, and sexual health specialists increasingly recognize that discussing sexual concerns should be part of routine health care for older adults. It is equally important to understand that aging brings natural changes requiring patience and adaptation. Hormone levels gradually shift, skin becomes thinner, and the body's response to stimulation may become slower. Men may need more time to achieve or maintain an erection, while women may experience reduced natural lubrication after menopause. These changes are common and should not be viewed as personal failures or reasons to stop enjoying sexual activity. Instead, they highlight the importance of adjusting expectations, taking more time for arousal, using appropriate lubricants when needed, and choosing approaches that prioritize comfort rather than speed. Listening to the body's signals becomes increasingly valuable with age. Many chronic medical conditions become more common after 60, including diabetes, high blood pressure, arthritis, and heart disease. Some medications used to treat these conditions can affect sexual desire, sensitivity, or performance. Rather than assuming nothing can be done, older adults should feel comfortable discussing these issues with their healthcare provider. In many cases, medication adjustments, lifestyle improvements, or simple recommendations can make a meaningful difference. Sexual health is part of overall health, and concerns about intimacy deserve the same attention as concerns about vision, mobility, or heart function. Perhaps the most important message is that sexual wellness after 60 is about caring for the whole person. It is not simply about physical pleasure, but also about maintaining self-esteem, emotional health, body awareness, and quality of life. Every individual has the right to make personal decisions about whether or not they remain sexually active, and there is no single definition of what healthy sexuality looks like. By recognizing that intimacy and self-care remain valuable throughout the aging process, older adults can approach this stage of life with greater confidence, comfort, and respect for their changing bodies. Many people assume that masturbation is something you either know how to do or you don't, and that once you've learned, there is never a reason to change your habits. But after the age of 60, the body is different than it was at 30 or even 50. Skin becomes thinner, muscles and joints may be less flexible, hormone levels change, and chronic health conditions become more common. These natural changes do not mean you have to stop enjoying your sexuality. They simply mean your body deserves a little more care and attention. Unfortunately, many older adults continue using the same techniques they relied on decades ago without realizing those habits may now lead to discomfort, irritation, or even injury. Understanding the most common mistakes can help you enjoy masturbation safely while protecting your health and maintaining comfort for years to come. The first and perhaps most common mistake is using too much force or excessive friction. As people age, the skin naturally loses some of its elasticity and moisture. In men, erections may not always be as firm as they once were, leading some to compensate by gripping more tightly or increasing pressure. This can irritate delicate tissues and, over time, may even reduce sensitivity. For women, menopause often brings lower estrogen levels, which can lead to vaginal dryness and thinner tissues. Without adequate lubrication, friction can cause soreness, tiny tears, or irritation that may take longer to heal than they would in younger years. The solution is not to force the body to respond as it once did. Instead, slow down, use a lighter touch, and recognize that pleasure does not depend on speed or intensity. A quality water-based lubricant can make a remarkable difference for both men and women by reducing friction and making stimulation far more comfortable. Taking extra time to become aroused also allows the body to respond naturally, making the experience more enjoyable and reducing the risk of injury. The second major mistake is ignoring pain or unusual symptoms. Many older adults mistakenly believe discomfort is simply part of getting older. While aging does bring changes, persistent pain during masturbation is not something that should be accepted without question. Pain, bleeding, swelling, persistent redness, or unexplained lumps deserve medical attention. Men who suddenly develop significant erectile difficulties or pain during erections should discuss these changes with their healthcare provider because they may be related to circulation, medication, side effects, or other medical conditions. Women who experience severe vaginal pain, ongoing dryness despite lubrication, or bleeding after menopause should also seek professional evaluation. These symptoms do not automatically indicate a serious problem, but they should never be ignored. Early evaluation often leads to simpler treatment and better outcomes. Paying attention to your body's signals is one of the most important ways to protect your long-term sexual health. Another common mistake is overlooking the effects of medications and chronic illnesses. By the age of 60, many people take prescription medications for conditions such as high blood pressure, diabetes, depression, enlarged prostate, arthritis, or heart disease. Some of these medications can reduce sexual desire, affect sensitivity, cause vaginal dryness, or make erections more difficult to achieve. Instead of feeling frustrated or blaming yourself, remember that these changes may have a medical explanation. Never stop taking prescribed medication on your own because of sexual side effects. Instead, talk openly with your doctor. In many cases, a different medication, a dosage adjustment, or additional treatment can improve sexual function while continuing to manage your overall health safely. Good communication with healthcare providers is an important part of healthy aging and should include conversations about sexual concerns without embarrassment. Poor hygiene is another mistake that can increase the risk of irritation or infection. Washing your hands before and after masturbation helps reduce the transfer of bacteria. If you use sex toys, they should be cleaned thoroughly according to the manufacturer's instructions after every use. Different materials require different cleaning methods, and using the wrong products may damage the toy or leave harmful residue behind. If a toy becomes cracked or damaged, it should be replaced because tiny cracks can harbor bacteria that are difficult to remove. Lubricants should also be chosen carefully. Oil-based products may not be suitable for every situation, especially if certain materials are being used. Water-based lubricants are often recommended because they are gentle, easy to clean, and compatible with most products designed for intimate use. Another mistake many older adults make is rushing the experience. As the body ages, sexual response often becomes slower, and this is completely normal. Becoming impatient or trying to hurry the process may create unnecessary tension and disappointment. Instead, allow yourself plenty of time to relax. Deep breathing, reducing distractions, and choosing a comfortable environment can make a meaningful difference. If arthritis or limited mobility makes certain positions uncomfortable, supportive pillows or different body positions may help reduce strain on the back, hips, knees, or wrists. There is no right or wrong amount of time for masturbation, and comparing yourself to your younger years only creates unrealistic expectations. Every stage of life brings different experiences, and adapting to those changes is a sign of wisdom rather than limitation. Finally, one of the biggest mistakes is believing that sexual health no longer matters after 60. This misconception prevents many people from asking questions, seeking medical advice, or learning safer ways to care for themselves. Sexual wellness remains an important part of overall quality of life. It can support relaxation, improve mood, encourage body awareness, and help maintain a positive relationship with your changing body. Safe masturbation is not about trying to recapture youth. It is about respecting your body's needs today, making thoughtful adjustments, and recognizing that healthy sexuality can continue throughout later life when approached with patience, comfort, good hygiene, and attention to overall health.